topic is public hearing for tax asking budget for fiscal 2024. At this point in time, I will open the public hearing. Note the time at 7:33. Anyone from the public here for comments, concerns, questions on the public hearing for tax asking? That's very hard to say. If not, I would ask for a motion to close the public hearing.
So moved.
Second.
Thank you. All in favor, say aye.
Aye.
Second public hearing is for the amended operating budget for our fiscal year 2023. I'd open that meeting a couple minutes later. Note the time, please. Anyone here from the public that has any comments, questions, or concerns? Hearing none, I would call for a motion to close the public hearing.
I'll move to close the public
Thank
hearing.
you. Second, please.
Second.
I have a motion and a second. All in favor, please say aye.
Aye.
All right. At this point in time, I'll call the regular meeting to order. Christy, you're up for the approval of the 23-24 budget.
Okay, our budget was published in the paper according to the regulations in the code. So we published that we would ask, our tax asking was $1,156,040, and that was a tax levy rate of $1.16707 per $1,000 valuation. Do need to discuss a little bit about that. So I don't know if you've been following the news, but there's a little bit of a error in the Iowa code. Some in 2021, there was some change in multifamily classification of multi-residential, like apartment buildings, those type of things, where that classification of property was eliminated and it was rolled into residential, but somewhere in the code, the Iowa Department of Revenue didn't kind of classify that differently. Iowa has really put it into a process that they're trying to minimize or limit the increases in residential property valuations from going up a lot each year. Well, they erroneously grouped multifamily and residential together, and now they're trying to fix that. So basically what it is, it changed the rollbacks. I don't know if you're familiar with the rollback in our property taxes, but if there's a rollback, so if your property is worth $100,000, the residential rollback is normally would have been 54.65%, so only $56,650 would have been taxable valuation to you. When they grouped it with the multi-residential property, the rollback was 56.49. So residentials were paying higher property taxes than should have been. Their taxable valuation was higher then. So they're fixing that. They've extended some of the deadlines of filing these. We do not have to go through the process of doing our budget again. We are allowed to ask for to remain with the same amount that we requested, the dollar value. So the 1.156040, $1.5 million in property tax asking is what we'll move forward with. The rate will probably change. The county has those new valuations. They will release those new property assessments out the 5th of March. We'll rerun the budget. It'll give us our new tax rate. We'll take a look at it. They've extended the filing deadline until May 1st, from March 15th to May 1st. We'll stay with, unless there's some glaring issue with it, we'll stay with our same tax asking and move forward and file it before the new deadline. But we want to see what those new assessed rates are at the May 5th when they're released from the county again, just so you're aware that that is all going on. Don't think it's a real big effect on us because our property tax portion of what the county pays is only 2.5% of what our of all the taxes that as residents of Shelby County pay, ours is only 2.5% of what they pay, so it's not gonna make, they're not gonna pay any more, it's just the rate's gonna be a little different. So just wanted to let you know, so our budgeted revenues for 2024 are $77,210,000, and our budgeted expenditures are $77,210,000 is what we published. So with that, I'd ask for approval of our tax budget.
So I would make that motion to approve the 2023-24 budget and certificate of taxes.
Second.
I'll second. What?
Yep.
23-24?
Yep, that's right. We have a motion and a second. All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Okay, now the operating budget.
So in 2023, we wanted to amend that budget because of the IPERS adjustment, which again is a paper adjustment just to account for a generally accepted accounting principle that we have to follow. So we budget on the accrual basis, and because of market fluctuations and decreases, we need to adjust for making sure that we have enough budget authority to make that adjustment if it should be as negative as what it potentially could be. So it doesn't really have any effect on cash flow or anything, or any tax asking, nothing. It just is a book entry.
All right, if we could get a motion on the amended operating budget.
I move approval of the amended operating budget for 2023.
We have a motion.
I'll second that.
Thank you, Terry. Motion and a second on the amended budget. All in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. The approval of the minutes from January 31st of 23. They were in your packet. Everyone get a chance to read through them. If so, I'd like a motion on the approval of those minutes, please.
I'll move the approval of the minutes. I'll second it.
Thank you. Motion and a second. All in favor?
Aye.
Opposed, same sign. Dr. Anderson, the medical staff summary.
Yes, we had our medical staff meeting on February 14th. I'll just highlight a few of the things for you. Kelly Lynch, our perioperative nurse manager, brought a order set for us to approve regarding multimodal pain management. It has to do with administering pain medications preoperatively and during the course of the operation so that patients will do better, have less pain afterward, and recover quicker. So the medical staff approved that. Nancy Gao, our director of pharmacy, had some information for us regarding hospice care versus comfort care near the end of life. There are some differences there regarding orders and how we manage things, and payment and things like that. So we had a little discussion about that. Because Dr. Hylison and Dr. Grelby will be going to full-time ER in July, there are some changes in how we're following some of our patients in the hospital. They both currently have hospital privileges to work along with the rest of us to take care of people in the hospital, but when they go to full-time ER work, they will no longer be working in the hospital medical surgical area, and so the rest of us will be picking up more work there, and currently we're in discussions and trying to figure out the best way to kind of redistribute the care of some of those patients. It's a work in progress. Dr. Paul Sherrod, our new ENT, was at our meeting, and we got a chance to meet him and welcome him face to face. I think that's pretty much it from my standpoint. Barry's going to talk about some of the other things that were covered at that meeting, so I won't repeat.
Any questions for Dr. Anderson? All right, thank you. Linda, the annual report for the auxiliary board.
Okay, I am going to share the 2022 auxiliary year in review, and I'm really happy Cheryl Ferry is here. She's our vice president this year, and so will be the president next year. We're thrilled to have her. Okay, so we developed goals this year, like the hospital develops goals, and we use the same format that the hospital does. And our first goal was to increase our membership by 30 volunteers. And so to achieve that goal, we took on several strategies. One was Cal Polberg, who's up here in the picture, and Cheryl presented at the employee forums and reached out to 150 employees to talk about what the auxiliary really did. And we got a lot of positive feedback that people didn't really realize what the auxiliary really did here at Myrtue. And then Cala's there at the table. Excuse me, she's the lead for this membership drive, and we had a table at all of our events this year, and we challenged all of our board members to recruit 2 new members to our membership. And then Ruth placed some information in the vital signs encouraging team members here at Myrtue to join the auxiliary. And along with that, we also worked on a welcome plan. We just felt we didn't have a good process for welcoming our new members, and Kala has reached out to all of our new members and asked them what they would be interested. Some are not interested in doing anything, and some are interested in being involved a lot. But we are very happy to have all of our members, those that are very active and those that are not. I participated in an Iowa Hospital Association volunteer Zoom that was related to recruitment of volunteers. So we really felt like we did a lot for membership this year. I'm very happy that we far surpassed our goal. We have 43 new members that joined in 2022. And when I say that, I mean, this is really a big number. About 6 months ago, one of our board members shared an article from Denison that their auxiliary had gone inactive because they didn't have enough members. And so the same year they're going inactive, we had 43 new members join, and we are 230 plus members. So I think we're doing a really fantastic job with that. Okay, for quality, one of our goals was to evaluate where we were with standards related to the volunteers' requirements. And with this, we didn't have a great process either. So Cheryl Burchett took on this responsibility. The volunteers who work in the gift shop and volunteer to do skilled care visits are required to have a background check before starting, have a health assessment every 4 years, influenza vaccine or the waiver, COVID vaccine or the waiver, and HIPAA and confidentiality statements signed annually. Well, we just didn't have a good process for keeping all that documented and making sure our volunteers did that. So we collaborated with HR. They were a huge help, and found out, where we were, and because of Cheryl Burchett's hard work at the annual meeting in February, we were at 100% for that. So if we have a state cert rate, we are in compliance. So really pleased with that as well. Then under people, our goal, we had a couple of goals. One was to increase appreciation of the employees. We felt like we were doing a lot to donate toward equipment for clinical departments, but we wanted to do more for our employees. So on the picture on the left, Patty Miller heads up the Valentine Tea, and we've had that for years here in the Oval Room. Well, this year we decided to do something quarterly. So Patty headed up the Valentine cookies and treats, we call it now. And now all of this is delivered to the departments, and that's because of COVID. We just found that the departments were so glad to see us, and we reached out to more people doing that than them coming to the Oval Room. So then in the middle picture there, it's not the greatest picture, but that is our Easter delivery. And you can see in the picture, all of those people delivering, volunteers, are past employees. And I just feel like that says so much about Myrtue as an employer, because even though these people have retired, now they're back as volunteers and proud to be part of it, Cheryl being one of them. And it's also fun for the employees to see past employees being active with the auxiliary. And then to the right there, that was our 4th of July delivery, and those were cupcakes. Again, a bunch of past employees there, and Deb Duran was leading this group and did a fantastic job. And then in December, we also did a delivery of hot chocolate. And I think, Karen, you've spoke of it, but it's been a lot of positive, really positive comments from the employees about this. And when we deliver, we also thank them for their service and really appreciate them. And the other thing is, we really appreciate them because they frequent the gift shop, so they're our best customers. The other thing under people, our goal was to maximize marketing and communication. And I can't say enough about what our marketing department did and does for the auxiliary. Excuse me. They helped us to upgrade a lot of our materials and things in the gift shop, signs, did a big article in the paper about the auxiliary. They have just been remarkable, and really want to thank them for that. And then one other thing we did was for the volunteers, and during Volunteer Appreciation Week, we had a breakfast with the board members here, and t-shirts were purchased by the hospital for the board members. And then there was a coffee break also for all of the volunteers that was hosted by Myrtue. Okay, under service, our goal was to just continue to upgrade our fundraisers. And this one is the Fall Bazaar, and you'll see Cheryl up there. Cheryl and Cindy Hansen were the leads for this. And this is our biggest project, our biggest fundraiser. And then the luncheon table, and then we had the gift shop represented, the Unique Boutique gift shop. And then, excuse me, Wava and Bev are there displaying a quilt. We had 2 quilts that were donated for raffles. And this was a really big success. And then in addition to our goals, we also have ongoing activities. And the slide to the right is the scholarships. And we award 6 $800 scholarships to students who are interested in the healthcare field. And this is a photo of the recipients for 2022. And then in the middle there is Jan Gieser, and she is the lead of the skilled care visits. And volunteers go and visit skilled care patients and offer them reading materials or other assistance. The one to the left is the POP tours, and Tina Reichel is there as auxiliary volunteer leading the POP tours. That's a pediatric orientation program, and first graders from the community, from all of Shelby County, can come and tour departments of the hospital, and this has been very well received. And then we have a newborn stocking hat and Afghan thing that we provide newborn stocking hats and Afghans to the newborns that are born here. And we have some great people who are knitting and crocheting, not Cheryl or me, but that are very dedicated to that. And then we also do a tree of lights where we sell an ornament in memory of someone, and those ornaments are out in the lobby of the entry of the hospital. And this is a picture of our 2022 board. We are missing a couple of members. And I do want to say, not all of these members were in the pictures in this presentation. However, they all do a great job. Every single one of them has projects that they're responsible for, and we have a fantastic board right now, and they're all instrumental in helping us to achieve our success. Next year in 2023, we will have 2 new board members, Joan Chamberlain and Nancy Osborne. And then I'd just like to take the opportunity to thank Barry. I feel like we work great together, and just the hospital and the auxiliary working together helps us to achieve our goals. And Ruth, I can't say enough for you. Every single board meeting, someone says, oh, we just couldn't do this without Ruth. So thank you so much for that. And really want to thank just all of our membership, because we have 200 plus members and they all really work together, again, to achieve our goals. So that's all I have. Cheryl and I want to just pass out a few things that you can look at later, but one is the Volunteer Voice. That's our new newsletter, and we will now be sending that to Janine so that you'll have that quarterly.
Thank you.
And the other, can't leave here without trying to recruit some new members. So if you're interested in being on our membership, we have these, and then we're just going to pass out some of our stocking hats and crocheted items so that you can get an idea. Okay, any questions?
Questions, Belinda? Thank you, very, very nice.
Where are you?
Good report.
Where was that?
Where was what?
Where was that?
Oh,
Just outside the door.
Oh,
Oh, it was out here?
Side,
Okay,
side.
cool.
Yeah.
I thought you went someplace fun.
it was fun.
I'm sure.
Right outside the hospital.
You mean like we do?
Thank you guys for all you do for the hospital.
And thank you.
Thank you for
You're doing an exceptional job.
Yes.
your drive. So, sorry.
Sounds like we are very nice.
Linda, you guys do a wonderful, hey Linda, you guys do a wonderful job in the hospital. Thank you for everything.
Yes, I agree.
We appreciate it, really.
I'll pass that on.
Please, do.
I should remember.
Mike is gonna join, so then I'll join.
We do have it.
Really?
There is no.
All right.
Wasn't that nice?
And I know it's very nice.
You remember.
You've got work to do.
All right.
Busy.
Thank you from all of us for that report and all the hard work you ladies do. It's great. Great, great, great.
You gonna try that out?
I need to.
See if they can make
All
it.
right, back to the agenda. Our agenda says the quality improvement report was deferred. However, I've been informed that Kara's here and ready to report. Yeah. Oh, maybe I should have mentioned that at the beginning of the meeting. I don't know. All right, I'm all right. So,
Okay, at the last quality member or department meeting, we had 14 departments report. Behavioral health, they are re-evaluating their documentation requirements and working really closely with the HIM. They also reported on employee and patient satisfaction. Cardiac rehab reported on monitoring the 6-minute walk test improvement for patients. So essentially, they evaluate patients as soon as they come into cardiac rehab and then at the time of discharge, and really want that overall stamina to increase. Dietary reported that they monitored meals, 273 meals for proper food temperatures, at almost 100% for that. Home health and hospice reported on the documentation of PRN or as needed medications, hand hygiene, patient satisfaction scores, and overall improvement of home health patients from the start of their episode of care to the end. Lab reported on the evaluation of blood usage. Maintenance reported on timely completion of work orders, reviewed quarterly evaluation of the safety report for the entire facility. Medical records had all new monitors that they were working on. They're looking at proper clinical documentation with a focus heavily on the ER notes, accuracy of OB coding, as well as when during surgery, the utilization of an assistant that is properly documented. For surgery and perioperative department, they really looked at criteria for surgery, which was met 100% of the time. There was no post-op complications, no post-op sepsis and blood clots, And then they're really working closely with infection prevention for testing services. It's called ATP testing, and Kathy Buman is working really closely with a number of departments for that. They also are evaluating any readmissions that come back after surgery through the ER and med-surg, and tracking all of that. Infection prevention, as I said, is working closely with that ATP testing, but any hospital-acquired infections, the big thing there is with Bugsy, is a new interface with Epic, and it's really going to help us report what we need to for the government for infection prevention. So that is kind of up and rolling. Rehab services reported on the completion of fall screening. Senior Life Solution reported on hand hygiene, fall assessments, and then follow-up phone calls. What they're doing new is calling patients that are discharged from Senior Life Solutions at 1 week, at 3 months, and then again at 6 months to make sure that they're doing okay. Respiratory therapy reported on two patient identifiers and adverse reactions, which was met 100% of the time. And they also reported that sleep study overread. Their goal for that is to have all sleep studies overread within 2 weeks. But they are getting that done in 6.7 days, and that's including weekends and holidays. So that was a really good number. Lastly, UR reported on readmissions and level of care, and those were all met at 100% of the time as well as tracking sepsis patients. I guess I didn't say on cardiac rehab, what's kind of going on with them this year is they're looking at a special accreditation for our cardiac rehab department, and this is kind of a year of data collection. So they started that in 2023, and then that will continue through the year. So that's exciting there. And then we continue to collaborate with Iowa Health Care Collaboration for our quality reporting. And that's it. That's all I have.
So there's an electronic program called Bugsy that
Yep.
reports infections.
Well, it's an interface. It pulls data. It pulls data from our electronic medical record, and then it talks with what's called NHSN, which is the national standard for that. And we have to manually kind of report some of that stuff.
Right.
And so this is an interface with our EPIC program, which will be a huge help, and it kind of it does a lot of that for you and kind of highlights that. So actually a lot of the quality reporting will be all done digitally with all measures in the future.
That would be nice.
The goal for that is January of 2025, January 1st, that all quality measures are pulled that way.
That would be nice. Bugsy, okay.
Oh, I see what you were saying.
Yeah,
Yes, Bugsy, the infection.
You guys are a little slow this morning. All right, let's move on to Karen Buman for the approval of the Joint Conference Committee revisions.
All right, so I don't have anything nearly as nice as crocheted blankets and all the pass around, just a big book of policies. Very exciting, I know. So we're a little behind. I'll actually be doing this this month and the next month. So we're actually going back to last November for our full year of policy and procedures that were reviewed. So as you're going through there and looking at the policies, I'll just do some highlights. This is also in your packet on page 8. Discharge planning, they revised their utilization management plan. Again, just looking annually at all of their policies for that department. Education had an agreement for education opportunities. So this is an agreement that can be made between our employees and MMC for any educational opportunity that they find out there. So that was a new thing for their year. Revised mandatory reporter is now offered online, and their new employee orientation is now every other month. So those were some highlights there. For infection prevention, their new policy was respiratory illness transmission precautions. So again, you have to remember this is going back a full year, so a lot of this is related to COVID. So they were actually kind of replacing their COVID policy with a few more broader recommendations. So kind of advancing a little bit past COVID into a little more broader for all respiratory illnesses that are out there. Did revise their varicella or chickenpox, adding an assessment for vaccination on our employees for that. And then again, deleted their COVID procedures as again, we're trying to go back into normal operations and broadening that out. They also, and you'll be hearing this more as we move forward, a lot of people are moving their policies to Lippincott. So the board did approve our purchase of Lippincott, which is basically a storehouse for all of our policies, as well as providing for a lot of, especially in the clinical areas, a lot of procedures, and it's best practice that's out there. So we don't have to go searching through lots of data and everything. It's all right there. They've already done all the research. They've got all the best practice. So we can just pull from that database. So we can put our policies in there as well as pulling their policies in for our use. So you'll see a lot of people referring to Lippincott policies as we move forward with this. So they had a lot of renumbering and putting their policies into Lippincott for that department. And again, you'll be hearing that a lot as we move forward. OB Birthing Center had quite a few new things. A lot of these things we've already gone over, but their new things were the Mother's Milk Bank of Iowa. They are a recipient for that, for breast milk, and also a dispensary for that now. They had some changes to their supplementation for their newborns, and then just some various revisions for the OB department. Pharmacy, as if you look through that, they have like 2 pages, so they have some changes to their guidelines. So you'll see a lot of new things coming out of pharmacy, just basically changing to these new guidelines. They'll be doing a lot more education of staff, going over these new guidelines for any mixing of drugs or anything that's not done in the pharmacy. They also have been working a lot on drug shortages, so I don't know if you've been hearing about that, but there's a lot of shortages of medications out there. So our pharmacy does a great job. They are out there with numerous different vendors trying to grab what they can of anything that they think might be coming up as a shortage. We've never really had too much trouble getting what our practitioners need here. Let's see. I think that's the major stuff for pharmacy. Oh, and then the other big thing with pharmacy is antibiotic stewardship. So you probably also heard out there, trying not to overuse antibiotics, to just use them judiciously. So we do have a committee that's been put in place, so she has policies, et cetera, for that committee as we review our use of antibiotics. Pretty much every time pharmacy comes, which is quarterly to med staff meeting, they're constantly giving education to the medical staff on what antibiotics are out there, how to use them appropriately, trying not to overuse antibiotics. Let's see here, safety manual. We did look at a full year at the safety manual for security. We talked to some about automatic locking of doors and our visitor schedule. And then just going through our normal fire, severe weather, workplace violence, everything, reviewing all of our policies and making any minor changes we had to those. So those were the full policy and procedure manuals for that particular quarter. Then we also look at for the particular year, then we also look at our quarterly policy and procedures and go over those. And again, this is multidisciplinary committee. We have medical staff, nursing staff, we have a couple board members on that. So we can look at our policies from a broad perspective. So this was actually April through June of last year. So at that time we had Mike and Kelly on that committee. So the policies and procedures for that particular quarter, cardiac rehab, and just like Laura was talking, they are working towards their accreditation, so a lot of new policies coming out for them. And then they actually deleted phase 3 for cardiac rehab because that is now performed over at the wellness center, so that was taken out. Diagnostic imaging, I think everybody's aware we've gone to nuclear med in-house now, so of course they deleted all of their mobile service policies and put all of the policies into in-house policies. Human resources, again, going back with COVID and just making some changes. The biggest one with that was the changing over to the latest CMS masking requirements. So at that time we've gone from masking to non-masking. So that's pretty much the gist of the policies and procedures for that quarter. So, and then, like I said, we'll catch up with next month and go over the latest. We have new people on the committee then for next month. Kate and Jan are on that committee. So, but I do need approval for the annual and the quarterly policies and procedures, unless you have any questions.
I'll make that motion.
A motion, second please.
I'll second.
I don't know who got that. All right. A motion and a second. All in favor, please say aye.
Aye.
Opposed, same sign. Motion carried. Thank you, Karen. Mr. Zimmerman?
I was unable to make the meeting, so.
I'll pinch it for Mr. Zimmerman.
Oh, all right, Mike.
We met this morning, the personnel committee did. There was one initial appointment 11 reappointments, and 2 voluntary withdrawals. Committee recommends approval of this credentialing.
We have a motion?
I'll second it.
Oh,
Tom's
okay.
got it.
Tom's got the second. All in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Barry, you are up for the CEO report.
So on the agenda, we have approval of revision to administrative spending limits policy. We sent the revised policy out. We sent that out on Friday. The main changes are to the CEO spending authority, basically clarifying some things, differentiating between capital expenditures, contracts, and other standard operating expenditures, and then increasing the amount from $50,000 to $100,000. We've been at $50,000 since 2015, so it's been about 8 years. And obviously, some pretty significant inflation in the last 2 or 3 years. So those are the main changes. I think this will provide a little bit more latitude in being able to take care of some of those monthly standard expenditures that in some cases are exceeding $50,000, like drug costs. Even our utility bills sometimes exceed that. So that I would ask for the board to consider approving that change to the administrative spending limits.
You get a motion on the revision of the administrative spending limits?
I'll make a motion to that effect.
All right, thank you, Tom. Second, please.
Second.
We have a motion and a second. All in favor, please say aye.
Aye.
Opposed, same sign.
Then I want to do an update on the ER project and our plans related to that project. We were planning to come to this board meeting with a public hearing and to get approval to move forward with that project. We'd hope to have all the bids at that point from the construction manager. But our initial bids came in some cases we only had one bidder on certain packages. So the costs were higher than what we had estimated. Working with the construction manager, they do feel like it would help to delay the project a little bit. We're competing with a lot of school projects right now, which is kind of affecting the number of bidders that we've seen. So we would like to delay the project so that we're starting in July, delaying it about 3 months from April to July. The project could be compressed a little bit by delaying it, so it would extend the project from June of 24 to August of 24. So it's a little bit shorter, slightly shorter time frame by extending that or extending the start of the project. We do expect that the new bids, we kept a lot of the bids, or we're trying to keep a lot of the bids that were good with the various packages, but we're rebidding some of those packages. And we're expecting that to be back by the end of March. So we'd like to have a board meeting, and you know, plans obviously change when it comes to construction. So this is what our plan is right now, is that we would have those bids back by the end of March, and then bring it to a board meeting in April, probably early to mid-April. We would set the guaranteed maximum price and hopefully get approval, do the public hearing as well at that same board meeting. So we are thinking about, you know, we are still planning on having that planning session with the board on March 23rd. Then what we thought we would do, if this makes sense, is combine the regular March and April board meetings and have it like on probably April 11th, but that's kind of a tentative date right now. And hopefully we would have that public hearing and be able to move forward with the ER project bids. So that's kind of where we're at with the ER project, cafeteria, that is going to be, needs to be a separate project. The ER project is a USDA project, so we need to keep the cafeteria separate, but we do hope that we're going to have an estimate on the cost of that project at that same time, April, early to mid-April, and then we would bring that, there would be a separate public hearing for that as well at that same time, and hopefully be able to move forward with bidding out that project at that time. So that's an update on construction projects.
What about the gift shop?
Yeah, what we would like to do is do that ourselves and kind of general contract that ourselves. And that's what we're working towards. Jeff and Drew are working on kind of the plans for the gift shop, working with the architect, and so in theory that's something we could start fairly soon. I think we would have to use some outside contractors to help with that project. A lot of it we can do with our internal maintenance staff.
Okay.
And, we'd really like to have that all done this summer, including the coffee shop that would take the new gift shop would move to the front side of the hospital near the main entrance, and then we would take their existing space and turn that into a coffee shop. So that's our plan right now. Do you have anything to add to that?
No, we should be getting a dedicated drawing for the gift shop here in the next couple of weeks, and then we can start the construction after that.
As far as recruitment, family practice recruitment, we did have a really good visit with a candidate a couple weeks ago, 2 or 3 weeks ago. She's in her 3rd year of residency at Sioux City Family Medicine Residency Program. She's from the Midwest, did her undergrad at Creighton University, medical school at Kansas University, born in Omaha, have family still in Omaha, raised in the Kansas City area. We did offer a position to her, and she does have other offers, so she's going to make a decision here early to mid-March. Hopefully we'll rise to the top there, and so hopefully we'll have some good news in March. We have had some other interest from some other candidates, but nothing has really moved forward with any of the other candidates at this time. We did have a discussion at the med staff meeting, and we do want to, we're trying to recruit 2 new primary care physicians. We definitely want one to be able to do OB and C-section, but the other one could be family medicine, or could potentially be an internist or internal med physician. So we are going to open our search to include an internist. They focus a little bit more on hospital care, as well as a little bit more on adults versus pediatrics. And so we are going to open our recruitment up to an internist as well. I think that's my update regarding recruitment. I mentioned to all of you tort reform that did pass, so we'll be capped, hospitals are capped at $2 million for non-economic damages, and other providers, physicians would be capped at $1 million. So that was really the main focus for healthcare advocacy this past year. There is some legislation, there is every year on certificate of need. There is again this year. Certificate of need is a process that you have to go through as a healthcare entity if you want to add new services and spend significant dollars on new facilities or new equipment, and it really kind of protects against overspending and overbuilding. I think the legislation that we're looking at this year is kind of exempting certain entities from that CON. Birth centers would be one, community mental health centers, mobile health services, cardiac catheterization services, They're also looking at increasing the threshold from 1.5 million to 5 million for certain capital expenditures. So if it's, right now, if it's over 1.5 million, you have to go through CON. They want to change it to 5 million, so it's easier to, stay under that threshold. So that one's out there as well. And of course, IHA, Iowa Hospital Association, always advocates against changing the CON laws. One of the big concerns is you have for-profit entities that come in from out of state. They cater to those patients that have better insurance companies, kind of cherry pick those patients and leave maybe those patients that don't have as good of insurance to the community hospitals that are required to provide emergency services and do all the community things that we do, like own a wellness center, provide behavioral health, all those things that we do that don't necessarily make a profit. So we've always really kind of advocated against changing those CON laws. So that's a big one that's going on right now. I think that's pretty much what I wanted to focus on today. I think that's all I have for my report.
Any questions for Barry?
Does delaying that ED renovation hinder the USDA grants at all? Does that affect that?
Shouldn't. We have until January of 25 to finish the project, and so now we're looking at August of 24 for the completion. So we still have about a 5 to 6 month kind of window there.
Any other questions for Barry? Okay, Christie? Financial statements?
So the January of 31, 2023 and 2024 statement, 2023, 2022, sorry. So outpatient visits, we were almost at 5,049.74 in January 2023, up quite a bit from last year. Year to date, we're almost at 33,000, which is about 1.8% higher than where we were at for the 7 months ended January 31st of 2022. ER visits were at 477. We're down about 2.6%, so that's roughly just a little under 100, a little under 100, so that's not a lot down. Surgical procedures, we're at 127. As you can see, we're starting to climb back up. We've been running a little bit behind. We are now at 2.3% higher than we were for the first 7 months of last fiscal year. Physician clinic visits are at 3,507 compared to 4,098 last year. We should start to see those climbs. We are still at 11% below. We've had a provider that's been out for the last few months, so that those will start to come back up. Behavioral health clinic visits were at 1,454 compared to 1,270 last year in January. We are at 13.2% higher than we were last fiscal year. Average daily census are at 10.78, which was good for January, higher than last year. Year to date, though, we are down 15%, which we're at 9.10. Of those, acute are down 22.2%. Swing bed is up a little bit at 3.4%, and observation is really staying about the same. For births, we've had 7 in January of this fiscal year and 3 last year in January. We are up 19.6%, so we've had 55 as of the end of January of 23 compared to last fiscal year of 46. Year to date, we've had 4.5 million in net operating revenue. Net operating expenses are roughly just a little over 4.5 million in January. So we had a $58,000 net operating loss, 334,000 in net non-operating revenues. Net income from all sources was 275,000 compared to $94,000 loss last year. Year to date, we're at 1.2 million from all resources and compared to 2.7 in 2022. 2022, we still had some COVID money coming in, so that's really the big difference there. Our revenues are up 6.7% compared to 7.2% of our operating expenses are up. So we are seeing a little bit of a hit, and our revenues are not going up as quickly as our expenses are. If you want to go to the 4-year comparison there. So we are still doing the 4-year comparison, which I think helps us take a look at where COVID affected us. So as outpatient visits, you can see there that we are higher than where we were prior to COVID. So we're almost at 33,000 compared to 2020. We were at 31,000. Emergency room visits have really dipped there in 2021 when we had COVID. So we are back up to where we were prior to COVID. Surgical procedures, we are still seeing the need to rebound a little bit, but we are seeing an increase in these this fiscal year compared to last. We'll see that rebound. You can see there in 2022, we did rebound to 28,000 in physician clinic visits compared to pre-COVID at 27,000. This year's dip is because of leave time. Behavioral health continues to be busy there. And as you can see, we continue to see a slight decline each year in average daily census. Births continue to climb there. And as you can see, our revenues increased during COVID just because of the federal funding that we received. Just to talk a little bit, in your packets was the balance sheet and the income statement. Just a couple things and notes there. You can see that our cash equivalents and investments have kind of flip-flopped. We've tried to take advantage of our of interest rates being a little bit higher in investments, so we've moved quite a bit of our cash into some short-term CDs. They're all less than a year old. They're less of a year than a year's term. Our accounts receivable are down. We're about 52 days. At one point when we transitioned from into Epic, we were at 90 days, so we've done a really good job of getting that down. Last year at this time, we were at 58 days of our revenues were in AR. And so when it takes an average of about 30 days to get initial payment, so it's really a pretty good. We'd like to be at 45 days, but we continue to work there. We are fully staffed. We're only down one coder, so we're doing really good there. Our allowance for uncollectible accounts is down. A lot of that has to do with our patient responsibility balances are down. So that gets our accounts receivable down, and our bad debt goes down because of that. So that you can see that on the financial report. Our prepaid expenses is up there because as our expenses climb, then our Medicare reimbursement doesn't catch up until we do the cost report. So we anticipate that Medicare, Medicaid will owe us some funding at the end of the year. If you look at liabilities below, some big changes there from year to year is advances to third parties. During COVID, they advanced $8.2 million for payment basically of Medicare payments. We've been paying that back over time, and in fact, February we paid all that back. So that has all been paid back to Medicare, and that payable to third party is where that either CMS, Medicare owes us, or we owe Medicare based on our cost reimbursement. The financial report, the income statement a little more in detail. Inpatient revenues have gone down. We're seeing Medicare Advantage plans, Medicaid, really do not want to see patients in inpatient. You really have to argue and fight to get patients inpatient. So we're seeing a lot more observation, which are considered outpatients in the eyes of the medical world. Even though they're actually staying here, they're considered an outpatient. So as you can see, our outpatient revenue is going up. And then charity care, we're seeing, that kind of depends on what claims we come in. We are seeing, we're doing a lot better job. This is Epic really, once they file charity care. In HMS, we had a lot of problems. It's all manual process. In Epic, it's more of an electronic process. Once somebody's indicated to be that they filled out a charity care application, it automatically flags it and it tells us that they've got more balances due, so that we can automatically go in and get them written off. We've been keeping up on a lot more estates, so if there's not a probate filed or there's nothing left in the estate, then we're getting those written off a lot quicker, so that would lead to that. So employee benefits, I know, is another one that's been climbing, that is really related to our health insurance expenses.
Makes the world go round.
Any other questions on the financial reports?
Questions for Christie? If not, I'd ask for a motion on the approval of the monthly financials.
So moved.
Motion second, please.
I'll second.
Thank you, Terry. Motion and a second. All in favor, please say aye.
Aye.
Pose same sign. Motion carries. The payroll and claims for January of this year were in your packet. Hopefully everyone's had a chance to review those. If you get a motion for the approval of those, please.
Moved.
Thank you.
Second.
Thank you. All in favor, please say aye.
Aye.
Pose same sign. Motion carries. Before adjournment, is there a possibility then, and I know you probably can't answer this, Barry, that if we would have a early April meeting, we may not have an end of March meeting then? Or?
Yeah, probably not.
Okay.
We do have that planning session for March
Right.
23rd, but I mean, I'd like to, as of now, I would say I would like to combine the regular March
Okay.
and April board meetings and have it on that, like April 11th is the date we're shooting for.
Okay, well, hopefully we can get everything you need by then, so. All right, if I could get a motion to adjourn, please. Thank you, Mike. All in favor?
Aye.
All right, we are adjourned.